This is Dr. Jim Anderson. I have Gracia here. She has a history of an arthritic foot problem in her arch, and we did some treatment with amnio product where we injected into her joint. It's really the regenerative medicine we do here. We've been doing this for like 5 years, but she did quite well and actually had to have 2 of them. A lot of people might just have to have 1, but I just want to talk to her for a second and just explain what your symptoms were like. What was it like before and what's it like now?
The symptoms were that I couldn't hardly walk on it. It hurt so bad.
Okay.
And it was terribly swollen at the ankle.
The ankle. And so what would bother you, like going up and down steps or?
Everything.
Everything? And
Yeah.
it's mainly right down in this area, I
Right.
believe. And she has a pretty significant flat foot. And in this joint here, this is called the talar navicular joint area, there are times when this joint there has to even be fused, where you go in, remove the joint, and get rid of the joint, fuse it, and it can work pretty well, but a lot of lab, like 6 weeks of off weight bearing. And nice thing about this, you can walk pretty much immediately, right? What was it like
Yes.
afterwards for you?
I had the surgical boot on and I could still walk. I think I wore that for about a week, 2 at the most.
Right, and was able to get around. We just did it here in the clinic.
Mm-hmm. Yes.
And so she actually had to have the first one. I think the first injection might have helped her 50% or so, and now she's up to 95 after having a second one. So that's really a nice option. I really love it. I'm excited about it. It's simple for the patient, and it's simple for the doctor too. So, okay, well, thank you.
Thank you.
Appreciate it.